Our intent was to transform healthcare quality in this region.
If you open your mind to change, and you think about change in a different way, because it's not easy, then it's an opportunity to take ideas that can be transformed into revolutionary innovation.
And this vision became the basis for our design decisions. The goal wasn't incremental change, but radical improvement in our ability to provide excellent care.
We had the opportunity to review, rethink, and redesign even the most basic aspects of patient care.
Decisions would be based on the most current clinical evidence or research linking physical design with patient healing. We also knew that the best plans are based on staff experience and input and ideas, so clinicians were involved in every phase of the project. We realize in a building with nearly 1 million square feet that getting where you need to go can be intimidating. Most hospitals are confusing for patients and guests, but this hospital was built to be intuitive in finding your way. One of the most prominent features of the hospital is the openness and the access to natural light and views of the outside. When you step off the elevator on any floor, you can see where you came in. This provides a point of reference and spatial orientation.
One of the key factors is how the flow of materials, supplies, and information come together to add value to the care of the patient.
The hospital was designed to protect patient privacy. There are separate elevators for patients, visitors, staff. Supplies and equipment move through back hallways and don't cross patient paths.
There are two sides to being a physician. Of course, one is professional. The other, however, is often very personal to the patient and often very personal to us. When patients come in the emergency room, minutes and even seconds can count. Everything was designed specifically with a purpose. There was a great deal of thought given to maximize efficiency and patient movement. The trauma rooms are larger, they're more efficient, all the equipment needed to take care of badly injured patients are in the room. Often that little bit of time can make a large difference in the ultimate patient outcome. We designed surgery to be immediately above the emergency room to again cut down on the time required to take that patient up to surgery. We designed the operating room with video integration, which allows a very precise image. We've given our surgeons the best technology to provide the most efficient, highest quality patient care.
In most NICUs, babies are treated in a common room. We changed that. With private rooms, we've provided space for the family to be with the baby. There's comfortable rockers and sleep space for the mom. And our goal was for the mom and baby to be together from birth, because that increases the chances for a better start for the baby, but also has long-term benefits for both. It's more comfortable for a mom to take a baby home from the NICU when she's seen and learned how to care for that baby with the support of neonatologists and nurses. We also designed a roof garden outside the NICU with landscaping for beauty and also the sense of well-being.
We've completely changed the way we think of nursing stations. Traditionally, the nursing station is located in the center of the care unit.
Rather than the old model of centralization, we moved the nurses' station from a central point and created a nurse station outside each patient's room. We observed nurses in their work, using CAD drawings and step counters to trace their movements. And we learned that less than half their time could they actually care for patients because they were walking to gather what they needed. In the previous hospital, nurses averaged walking 44 steps to get something they needed from the workroom. Here, it's 19 steps. Fewer steps translates into more time for patient care.
Today, with the use of nurse servers, we can now stock the supplies on the outside and pass them through to the caregiver. Now, the caregiver has immediate access to supplies and does not even have to leave the room.
In this hospital, all the rooms are private. And when we talk about private rooms, we mean from our 2-pound neonatal patients to our very frail elderly patients.
Families are such an important part of the healing process, we designed larger rooms to accommodate them. We wanted to make patients more comfortable and give caregivers more space to do their job. We can move directly into the bathroom, in which there's antimicrobial surfaces that eliminate bacteria in many cases. The shower itself, you can walk right into and come right back out. There's no step. This will reduce falls throughout the entire hospital.
The rooms have nearly floor-to-ceiling windows that allows natural light that enhances the body's normal circadian rhythms. This adds to the ability to sleep. More sleep promotes healing and reduces complications. Healing the sick is part of our mission, and we take that very seriously. The people that we treat are our families and friends and neighbors, and we want them to have the highest quality of care.
The staff of this facility have accepted the challenge and have begun to integrate aspects of healthcare that I don't believe you'll find anywhere else.
That's why we spent years studying the research, learning from everybody we could, and listening to patients and staff in order to get it right. We care about this community in this region, and we hope that you can see that when you visit. We've even planned beyond what you see now. We know where the next wing will be added, where the next operating room will be. We wanted to ensure that our design goals and our vision for ideal patient care endured into the future. We're a top 2% hospital. We've been named a top 100 hospital. Just imagine what we can do here.